This is the Chapter 12 lecture on diseases and conditions of the reproductive systems. And as you can see from the very first page of the system, this is a very first page of the chapter. This is a very long chapter. It includes conditions of both the male and female reproductive system. And you certainly need to look back at the normal functioning reproductive system, and that's what we cover on the first few pages of the chapter, taking a look at the parts and how they work of both the male and female, and looking at the involvement of the hormones in normal functioning. That will always help you to understand the abnormal, is to first understand the normal. There's only a few conditions in this chapter that I will be skipping over, so you'll want to make a note of the ones that I will not be testing you on. And the list is really short. Okay, these are conditions you will not be tested on. And the first of the conditions that I will be testing on would be the sexually transmitted diseases. Turn over a couple pages after you've reviewed the normal anatomy of the system. What you'll find in your textbook is kind of alarming about the number of cases and the number of different types of infectious diseases that are spread by sexual contact. Formerly, these conditions were called venereal disease, or VD. Now they're STDs, sexually transmitted diseases. The thought here now is they're not diseases that just affect the reproductive system. These are diseases that can affect many systems in the body. There's more than 20 infectious diseases that are actually spread by sexual contact, and many of them are incurable. The ones that are viral in nature are the ones that are incurable, though there are medications to help with the symptoms. And then again, there are those that are potentially life-threatening. I've got the first screen up about chlamydia and gonorrhea, the number 1 and 2 sexually transmitted disease in the United States. It's really common for a person to be infected with more than one STD. No one's immune to the STDs. It's all about a person's behavior as to whether they will actually contract an STD. Certainly their sexual behavior. Chlamydia is actually referred to as the silent STD because chlamydia is usually asymptomatic in both the men and the women. Now, there are cases where the person does have some signs and symptoms, and I've listed here that the woman could have a thick vaginal discharge, burning and itching of the external genitalia, even some abdominal pain and painful intercourse. But most women are asymptomatic, and they really don't have any idea that they are infected with chlamydia, and therefore they will spread it to their sexual partners. The men will usually have some symptoms 1 to 3 weeks after exposure, including discharge from the penis, burning sensation when urinating, and or swelling of the scrotum. But then again, men and women both can be asymptomatic, but the men usually know that they have it a little bit sooner than the women may realize that they are infected with this STD. Looking under the etiology, this is a bacterial condition, and because it is caused by bacteria, it is usually curative with antibiotic therapy. Usually erythromycin is going to be the drug of choice in treating patients that have chlamydia. Of course, the person can be reinfected, so it is very important that the sexual partners are identified that have chlamydia, that the person and their sexual partners will be treated for the condition. As far as diagnosing the condition, it's usually just listening to the woman's symptoms or listening to the man in the office, and then there are lab tests that can be done, cultures that can be taken of the secretions, and lab studies can show the infection and definitely identify the bacteria. The chlamydia, just like all of the other sexually transmitted diseases, can cause some really serious problems with people who are pregnant. Newborns can acquire chlamydia from infected mothers during birth, resulting in conjunctivitis, maybe even blindness, or overwhelming infection. Also, a person that has chlamydia is more likely to go into preterm labor, have premature rupture of membranes, and actually deliver a premature baby. The next condition to look at is gonorrhea. Gonorrhea is also caused by bacteria, and therefore can be cured in most cases with the antibiotic therapy. But again, all sexual partners must be treated. And then if someone is reinfected, they must go through a round of the antibiotics again. Tetracycline and penicillin have been used to treat gonorrhea in the past, and there's many strands now that are resistant to those particular antibiotics. So it's more common that the ciprofloxacin or the doxycycline may be actually prescribed to treat the gonorrhea, because there are some antibiotic-resistant strands. Just like with the chlamydia, the symptoms are about the same, or the patient can be asymptomatic, and the woman not realize she has it, the man not realize they have it, and then they go on to transmit it to others. Especially danger is for the pregnant person, because again, this is a infection that can be transmitted to the child, and can actually, it's especially bad when the baby is born through the vagina, like most babies are. Their eyes may become infected, which can lead to blindness. There's a picture here of showing a gonorrhea infection of an eye, and then you see a picture much like that showing the gonorrhea ophthalmia, picture in your book of that. So it's especially a danger to the child, the unborn child, and the fetus. Males will usually develop symptoms 3 to 6 days after infection, just like with the chlamydia. But again, females may or may not ever even have symptoms that they're infected by the gonorrhea. Could be that male and females produce a purulent discharge, a pus-filled discharge from the urinary tract. They may have dysuria. Your book uses the statistics of up to 50% of men are asymptomatic. So again, this is one that can certainly be transmitted from one person to another because there's no obvious symptoms there in many cases. Once a person does have symptoms, when they go to the physician and describe this, again, the cultures can be taken to identify exactly what bacteria is causing this. If a person's not treated for the gonorrhea or even the chlamydia, the person can end up having the female pelvic inflammatory disease, which can lead to sterility, may have septic arthritis, septicemia. The organisms may actually enter the bloodstream and cause a systemic, even life-threatening infection. It's so important when someone's being treated for gonorrhea that they return for follow-up to be sure that the antibiotics that they've taken were the correct antibiotics, and that the particular strain of gonorrhea they have is completely gone, or they may need another cycle of antibiotics, perhaps even a different type of antibiotic. Okay, the next sexually transmitted disease to describe is the trichomoniasis. Caused by protozoa. Again, very commonly asymptomatic. The person may have some, the man may have some dysuria and itching, the woman may have dysuria, itching, and a greenish yellow discharge But the thing about the trichomoniasis, they may have the itching and the discharge and the painful urination, and then their symptoms will go away. It's not that they're cured by any means if they haven't had any type of treatment. It's just that the symptoms have gone away, but they're still actually infected with the organism. So that greenish yellow discharge may disappear, but it does not mean that the infection has really left the body. Of course, if the person will go in for treatment and describe their symptoms, if they have symptoms, could be completely asymptomatic, then a culture can be performed to determine which sexually transmitted organism the person's infected with. Prognosis is good if both the partners receive the medical treatment, and again the follow-up exam to be sure that the infection's actually cured. But if both partners are not, or I guess I need to say all partners are not treated, then the people will continue to be reinfected. The next condition to describe is one of the sexually transmitted diseases that is not curable. In your book, they show some pictures of genital herpes in the female and the male, and I have actually a picture on the screen of, and I can hardly even look at these things. They have such blisters on their face. This is one that he actually has infection of the herpes and the blisters on his face, because this can be transmitted certainly by oral sex, or anyway, the person may have the blisters anywhere that they have come in contact with the genital herpes blisters, whether it be on the anus, whether it be on the penis or the vagina. They're very painful sores, but they don't, just because they're infected doesn't mean they have the painful sores. The sores will be present for a certain amount of time, and then the sores will disappear, but the person still has the infection. It's caused by a herpes simplex virus type 2, abbreviated HSV. Scary statistics here, 1 in every 5 adults carries this virus, and they may be asymptomatic. They may not realize that they are infected, or they may know that they're infected because they've had those painful blisters break out, they've had the flu-like symptoms, swollen glands, and then their symptoms aren't showing up anymore, but they are still infected because there is no cure. There are prescription drugs that can be taken, and I've listed some of these with their generic and brand name, like the Zovirax and the Valtrex. And again, these drugs do not cure, but they do reduce the duration and the frequency of the breakouts of the time that the person's going to have the actual blisters. Again, it's a systemic infection that they may have swollen glands, fever, headache, flu-like symptoms, but the symptoms will go away for a while and then recur later. Again, major perinatal complications may occur. If a woman is known to have genital herpes, then the baby should be delivered by C-section to avoid the infection as the baby actually moves through the birth canal. Genital warts. This is another viral sexually transmitted disease. It's caused by the human papillomavirus, abbreviated HPV, and causes these very obvious lesions on the genitalia, either, of course, on the penis of the male, the vagina, the vulva, or the cervix of the female. They're painless. They may itch at times, and it usually takes 1 to 6 months before a person actually has a breakout after being after contracting the virus. Now the lesions could be removed. They could use the physicians could use a chemical or surgical removal, but just because the warts are not present doesn't mean that they're not still infected. They're still infected with HPV. They just don't have the the obvious warts on the outside of the body. Pregnancy, when a person becomes pregnant, they're more likely to have a spread of these warts on the genitalia and then even past the genitalia. The most dangerous part of having the HPV would be the fact that a person is much more likely to develop cancer of the penis or cervical cancer later. It's usually that they'll be infected maybe as teenagers, 17 years old, 20 years old, whatever it may be, and then they end up with the cancer when they're 26, 30, 35, later in life. That's cancer of the sexual organs. In your book, there is a section on enrichment that gives you additional information about a human papillomavirus vaccine that helps prevent infection with the virus, therefore would help prevent the later development of cervical cancer. As far as diagnosis, again, mostly the doctor can just diagnose this by looking at the warts. Certainly a biopsy can be done to be sure that the person hasn't already developed the cancer, but it's pretty obvious to the trained eye what those warts look like. Okay, this one, the next one that I'm going to talk about is syphilis. Chronic systemic sexually transmitted infection consists of 4 stages. The very first stage is the development of this sore called a canker sore. A canker is a painless but highly contagious lesion that's going to be on the genitalia of either the male or the female. Without the early treatment during this primary stage, it becomes that systemic chronic disease that can infect or involve many organs, and I have pictures of the different organs in the body that may be affected. You see, these are major organs like the brain, the heart, and the liver. In 1 to 2 months, when the primary lesion heals, and the person doesn't have the canker anymore, the organism has actually spread through the body and multiplied, producing lesions in either the skin, lymph nodes, cardiovascular system, brain, spinal cord, either or all of those areas. The disease continues to be contagious during that secondary stage. When there's systemic manifestations, the person will start having fever, headaches, aching of joints, even mouth sores may develop, rashes on the hands and other areas of the body, especially the hands and the feet. There's a latent period lasting from what they consider 1 to 4 years following the infection, where they seem to be kind of asymptomatic. That'd be the third stage. Now, the very last stage, if the person has not received the proper treatment, lesions that have invaded major body organs begin to cause widespread damage to the point of syphilis actually being a disabling, life-threatening infection. Certainly, without the treatment, the person will go on to go through these stages. They'll go through, like I said, 1 to 40 years, a long time before they develop those life-threatening problems in the major organs, the heart and the brain and so forth. But eventually, if they haven't been treated properly, they're going to have damage to these major organs. Syphilis is caused by spirochete. It's a particular type of bacteria, and it can be truly cured with penicillin. A course of penicillin G, but after the person has been treated with the penicillin, they certainly need to have the follow-up to make sure that the penicillin did completely cure the condition. It's a danger during pregnancy, just like the other sexually transmitted diseases. During pregnancy, the baby may actually die in utero. The baby may be stillborn. There's some very serious complications that go along with having a syphilis infection during pregnancy. I am going to skip several conditions here, several conditions in your book, and I'm skipping over to the beginning of male reproductive diseases. And at this point, I'm going to end part 1.